if a person utters something for the very first time ever in a safe place can be the most healing thing ever. People that go on to develop PTSD that I've seen have something rooted in early childhood. The more resilient a person is, the more likely they're able to overcome different experiences in life. Resilience builds up in early childhood. The EMDR is a modality of psychotherapy to work with trauma, helping the client move their eyes left to right, left to right, left to right, left to right. And whilst they were breathing deeply and thinking about where they were feeling the distress in their body, and 9 times out of 10, the whole thing that they were thinking of would be completely reduced. And this is the other thing, like when the system is flooded with emotion and we're using EMDR, more often than not, it's never going to get that bad again with that particular thing.
Hello and welcome back to the second episode of The Art of Living Well. If you're somebody that likes to listen to these episodes on the go, whether you're driving, walking, or going to the gym, then you can listen to these also on Spotify. There is a link in the description below. You don't need a premium account to be able to listen to these on Spotify. In this episode, I have a psychotherapist on, and we talk about mental health, why it is so prevalent in our society today, and the impact of previous traumas in our lives and how that affects us today, particularly in terms of conditions like anxiety and PTSD. And we look at what EMDR is, which is a psychotherapy modality. And we get some insights into what a psychotherapy session looks like. So if you're somebody that struggles with your mental health, or you just want to maintain your mental health, then this definitely is the episode for you. So I hope you enjoy it. Let's get straight to it. Victoria.
Hello.
What do you do? And why do you do it?
So, hi Stephen, nice to be on this podcast. So I am a psychotherapist. I'm an integrative psychotherapist. So I draw together different theories. I don't have one particular model I follow. Depends on the clients I have as to what I use. I train to work with children. And that was my first training, and I branched out into EMDR modality as well. I have a private practice, work about 4 days a week, and it's going well. I've been doing it for about 10 years now, training and practicing. Yeah.
And why do you do it?
That is a really good question. And when people ask me that, I do think sometimes back to my own journey a lot of the time. So I think a lot of psychotherapists and counsellors will have come across some kind of therapeutic help in their lives at one point. For me, that would have been my mid-20s. I had a bit of a time when I was searching a lot, spiraled a bit, found myself getting a bit lost, and I noticed that I probably needed to get some help. So I met some therapeutic people, and they helped me on starting to question around my own life journey, really, what had happened to me, my childhood, things that I was doing now that I wasn't happy with, or things that I wasn't comfortable with. And it was a very healing time, very important time in my life. And it was just at the right point for me, I feel. So it was probably a few years after that as to when I decided to start a journey to try to help others in the same way I'd been helped. And it wasn't until I had my first child that I started to read about how babies' brains develop and how the nurture of a baby can bring about the development of connections in the prefrontal cortex particularly, but also just in terms of attachment and the relationship between the carer and the baby that really gives that infant a good enough start in life. I found it very interesting to read and discover, as I was nurturing my own child, how these things came about. And I think also then thinking about when it's not good enough, or when there's complications, either through birth or pregnancy, sometimes family difficulties, or other things in the mix, that some infants don't get, or have a different start in life. And sometimes the early years can then be complicated, or it's difficult for carers to find a place of stability for themselves, perhaps, or even in sort of sense of like having maybe not the same start for themselves, so it repeats in families, or generational repetition.
Yeah.
But also in the knowledge that it's okay to make mistakes as a mum, new mum as well, just in terms of that realization was quite a good and a relieving sort of prospect, because often new mums are sort of like, I must do everything correctly and perfectly and never mess up. And but just reading around that and experiencing that's fine, and it's okay to have a rupture, and then it's okay to then repair it, or to seek a different way. But I suppose leading on to that, I discovered a course in London where I could study and research child development and child psychotherapy. It ended with a qualification in child psychotherapy. And so I applied to this course when my first child was about 11 months, and started a foundation year managing both things at the same time, which was a bit of a challenge, I have to say. But and very eye-opening, and just really sort of journeying into even further and deeper into my own things, and just allowing myself some space and time to think and notice, okay, what are my patterns of behavior? How do I relate? What's my attachment pattern? What things have happened to me in my life to set me on a trajectory or not? How do I deal with conflicts, or how do I deal with people? And I suppose the sort of beginnings of that was just really, let's look at all those things, but also this course was particularly arts-based. So we had a lot of, we had a brilliant sort of opportunity to explore using different types of art, so sand tray and painting, puppetry, drama, kind of therapy, and it was all done with that sort of therapeutic distance. So it was, very, very influential.
See, being the same surname, we for those of you that don't know, Victoria's my sister-in-law, and that's quite interesting because I mean I've known you for quite a long time, and I didn't realize that you got into it because you had your own personal thing going on in your 20s, which I find is fascinating, because I think that a lot of people get into what they do quite often because they had their own personal experience. That's certainly the case with me. When I was in my teens, I had back issues, I had headaches, and I was helped by a chiropractor, which then inspired me to be a chiropractor. What was it that you did? What is it that you actually experienced that then led you on to what you do now?
I suppose just in the way that you felt like someone with expertise, qualifications, and the practitioner status that the chiropractors have, you were treated and helped. And I felt that absolutely, because I had absolutely been met and helped with my own journey, just actually helping me to think more kindly and compassionately about myself, I think was a start. and just helping me see things from a different perspective. It was really, really important for me to think about how I could pass that on.
What was the initial symptom for you that led you to find help?
For me, so in my mid-20s, I had just finished a course in acting in drama school, and I have a performance arts background, and I was probably about 25, 26 when I completed that course, and there's high hopes when you're in drama school, like for all the industry and the getting into jobs and things, and with that comes a responsibility, like, just absolutely sometimes needing to propel that yourself. Some people get very lucky, some need to work very hard. I was in the latter category, but I wasn't robust enough, I found, to cope with the demands of the industry. It was difficult for me, I found. I think probably ultimately I came to a point of not being able to cope very well with just daily life and things, getting emotional over small things or feeling panic rising, not being able to reach out for help. And I suppose that was a point where I was a bit desperate, actually. And at that point in my 20s was a turning point for me, I think, in terms of I could have gone one way or another. And so it was quite interesting how things started to fall into place as soon as I mentioned to someone else, I'm feeling this way, I don't know what to do about it, can you help me? And the moment I kind of admitted that to myself, but also to other people, things started to change.
And that's interesting. And I assume you see this, that women tend to do that better than men, don't they? They tend to be able to admit when they are when they're depressed, or when they've got anxiety, or when they're struggling, particularly mentally. I think there seems to be a bit of from what I see at least, a bit more of a stigma on mental health than there is on physical health. But actually, even physical health, it's a lot easier for male patients to bring in their wives than the other way around. And so for at least the perception that I have is that men tend to think, I can get through this. But I think with mental health, I perceive that there may be a feeling of weakness when you admit that you need help for mental health. Is that something that you see?
I've found that sometimes people come in quite worried about the fact that they walked in the door.
Right.
Worried, nervous, not sure, unsure, not trusting. But there's something that's made them walk through the door. It's something that as a psychotherapist, I try to observe even the beginnings of a clinical relationship. Even the first phone call or the first email, how that comes across, what kind of language they're using. But it differs. Typically men, I would say, but it does differ.
Is there any common misconceptions that people come in with when they start therapy?
Interesting question. Yeah.
About anything that they believe that is not true. I mean, I certainly get many misconceptions about chiropractic. Do you get anything in regards to what you do?
Yeah, I'm just trying to think, actually. I mean, I think things have changed in the fact that people are talking much more about mental health now. There's been a shift in the last 10, 20 years of people going to see therapists and it not being a stigma or a shameful thing or a quiet private thing. So for some people it is, obviously, but I guess it depends. It depends culturally as well. I think sometimes if culturally people have never come across this kind of world before, their family has never talked about it, or They've never had a chance to think around what's happened to me and that's making me feel this way or think this way about myself and other people. When they come into therapy, it sometimes surprises them that there is a kind person or a person to listen and to hear what they've got to say. And sometimes the first question to ask would be, tell me a bit about how it was for you to walk in this door today. And that can be an opening to very interesting and insightful conversation around what it feels like to come into therapy. And sometimes people are like, yeah, it's such a relief to come in. Been waiting this for a while, and they've clearly planned this step, and other people are more hesitant body language wise and other things. But I suppose the most important thing for them, and this is part of the training in terms of, being a clinician, is the safety aspect of what it feels like to walk in a room with one other person. And there is a bit of a I suppose, like a dynamic there, but already when you walk into a room with a clinician, the clinician has studied and is qualified professional, and the person that's walking to the room is a client, maybe a paying client, and there's already a dynamic there. So how can I as a clinician make it so that that can just settle and we can be two humans together? I'm maybe a 1 or 2 steps in front of that other person, but I'm there to create a safe space.
Yeah, that is a common thing, isn't it? There's almost like I don't know what you call it, like a power play, a power struggle, because automatically you are the one in charge, obviously, which is why they come to see you. But you've also got a power of knowledge over them. Again, another reason why they come to see you. But that can also then make it harder for you to have a good, I suppose it can initially make it harder to have a good rapport, isn't it? Not necessarily something that has to continue in that way. What would you say then? What are some of the most common reasons why people come to see you as a psychotherapist?
So I work with children as well. So I work in a school. Children that I see are referred by the school, and usually the teachers or staff have noticed a behaviour in the children that they refer to me that maybe they think I can help with. Sometimes they've got autism or ADHD or a neurodiverse behaviours. Sometimes there'll be a known family issue or difficulty. So those are the kinds of things in terms of for children. For adults, it varies again. So, I was looking, I think I told you I was looking at the intake of clients I've had over the last couple of years and the types of referral information that come through, and it's very wide ranging. So sometimes people come in for physical pain or things of a physiological nature that they've heard that EMDR can help with. Sometimes they've said to me, I just want to know how my brain works and figure out why the thoughts are coming in so much, or I've got intrusive thoughts. Sometimes it's a very clear, I've had this trauma in my life and I'm still thinking about it. Sometimes it's relationship issues or a divorce that's happened. Occasionally I'll have a parent who's really struggling with their child or at home. So it's very, very varied.
Yeah, a lot of different stuff. Is there any patterns you've seen or anything that surprised you with what people do come in with that you maybe surprised you compared to when you weren't working as a clinician?
Yeah, interesting question. I think what it boils down to for me is I've noticed a pattern of when people come in with an issue, usually we're going back to early childhood, whatever the thing they've come in with. The early childhood memories, things that have happened, even the sort of things that people will never think of being an issue, we look at. I don't offer that as a, like, we're going to do this. It gets uncovered along the way, usually. Not every time, but particularly with early childhood, when the brain is in full development, as it is then, that young child is completely reliant on the adults around them, in a way that, they have no other resources in a way, like grown-ups do. Grown-ups can go to the doctor by themselves. They can ring up their friend. They can watch a film to make them feel better or go for a walk. Children have to rely on those around them. And so when there are complications or difficulties, sometimes memories resurface, and particularly in the body. So when a person comes in for treatment for maybe body sensation, like they're having panic attacks, or they are having hot sweats in the night. Sometimes when we dig deeper, those things started very, very early on and have manifested into a regular occurrence or something that's got blocked in adult life.
Why do you think that is? Why do you think that a lot of issues that people have now is due to trauma early on? What is it that happens in the brain when that trauma occurs, and why is it that we can't just kind of get rid of it there and then?
Yeah, and for some people they will. That's the interesting thing. PTSD only occurs in 25% of people that experience the same kind of trauma. So 9/11, about 25% of people went on to experience PTSD.
Have you seen any patterns to why those people hold on to it and why others don't?
So there's a word that gets bandied about a lot at the moment. It's called resilience. And so what I've seen in my work is that the more resilient a person is, the more likely they're able to overcome different experiences in life. So resilience builds up in early childhood with things that happen. Things always happen in early childhood, spills, trips, falls, crying and all kinds of things, ruptures, as it were. Depending on how that child is met, or depending on what happens next, in terms of how often it happens as well. So if it's just a one-off, usually it doesn't matter. But if it happens repeatedly, and repeatedly that child has not been able to make sense of themselves or their bodies or the way their thoughts are going, or they start to feel guilty for things that aren't their fault, then perhaps that gives them a message of, I can't cope, or I have to take on responsibility for this thing. And sometimes their brains and bodies are too young to take on that much responsibility, or to not be met. So sometimes then what can happen is the system gets overwhelmed, the nervous system gets overwhelmed. And sometimes you can see it in behaviours in children. But more often than not, I would say people that go on to develop PTSD that I've seen have something rooted in early childhood that's just rooted there, blocking them from moving on from whatever it is, stopping them from receiving, or even if they have help, to actually really embody it. And yeah, it's interesting how it's indiscriminate in terms of, all walks of life. Resilience does not have a sort of similar pattern of culture or anything like that.
What therefore makes someone resilient?
Good question.
Is it, I mean, because resilience is, I feel like when you're an adult, you can, in some degree, work to become resilient. I mean,
Mhm.
physically,
Yeah.
that's quite easy, isn't it? You just go to the gym and you do sport and you can kind of challenge your body physically so that you can then cope with more challenging things physically. How does that work mentally, particularly as children? Why is it that some children are more resilient than others? I assume parents must be a big part of that.
Yeah, I mean, sometimes it can be from the very early moments of a birth trauma can make someone feel, make a baby be very, completely vulnerable in the beginning. All babies are vulnerable, obviously, but a birth trauma is a particular set of circumstances where the parent can be traumatized as well as the child, which can lead to a double set of circumstances where that baby is extremely vulnerable to all kinds of things, and their body is expressing that. Sometimes you discover my baby's crying all through the night, or they have colic or some kind of feeding issue or something, and then it becomes very hard to help that baby soothe or self-soothe. The children that come into the world that have a good birth or a good pregnancy, well met, and the parents are taking care of themselves as well as their children, they don't have any blocks to flourishing or growing up in a good enough space. And it's unfair, I think, sometimes. I feel sort of it's for some people it seems like a very unfair set of circumstances that's brought them to this position of being not resilient enough to cope with things. And I feel, I think there's a sense of clinical compassion for that, just that the individual's journey to get the help they need much later than they could have maybe had it.
And so when you're saying birth trauma, I'm assuming you mean physically, right?
Yes.
Yeah.
Yes, definitely.
And that can lead to them kind of transition to mental traumas.
So, sometimes it depends. It really depends on what happens next. I think obviously there's physical issues that happen sometimes as well, and health issues. But it's not the most ideal start to life. And so with different environments or things that happen, babies and children can then grow to sort of be shocked or startle at everything, or to have that sort of nervous system amygdala fear response at a lot of things, and find it hard to self-soothe and hard to settle to sleep, and the stomach can have problems. But yeah, I mean, it also just depends on lots of different factors.
Yeah, it is quite interesting, isn't it? How physical and mental is very much linked. And you mentioned earlier how some people come to see you for physical issues, physical pain. How do you think that works? Because I have heard stories of people dealing with a mental trauma and their back pain going away.
Yeah.
Why do you think that works? Because that might sound very surprising to a lot of people.
Yes. So I work with EMDR. So EMDR is a modality of psychotherapy to work with trauma mainly, but it also works for all kinds of things, depression, anxiety.
What does EMDR stand for?
Eye movement desensitization, reprocessing. And it was developed in the 1980s and 90s by Francine Shapiro, who discovered it serendipitously. It's quite an interesting story, actually. She was going through a few difficulties herself in her own life, and she, to sort of cope with her situation, she started to go on walks around her neighbourhood. She noticed she was thinking and feeling one thing when she left and went for her walk to clear her head. And she noticed that it worked. It sort of helped that thing that she was thinking of reduce in distress and disturbance, and she felt better. She started to do a body of research on what it was about the walk that helped her feel better. And she discovered that when she was out and about, her eyes were moving around the environment, sort of back and forth and back and forth. And her feet were bilaterally moving, of course. When you walk, you bilaterally move your feet or run. And those two things, particularly the eye movements, she discovered did something to the brain to help the brain resolve the distress or disturbance that she was feeling at the start of her walk. And she started to try this out in a clinical setting with fellow students and peers and other people in her cohort. And she began to see these changes that were being made when people start to think about something difficult that happened to them, and helping the client move their eyes left to right, left to right, left to right, left to right. And whilst they were breathing deeply and thinking about where they were feeling the distress in their body, and 9 times out of 10, the whole thing that they were thinking of would be completely reduced. The body would feel more settled, and it would produce this feeling of, okay, well, that happened and I'm okay about it now.
Why does that work? Because you've got the eye movements is a big thing. So you're going side to side. And so from what I understand, you're doing that at the same time. And it's not just eye movements, is it? It can be other things. Yeah. And you're doing that at the same time as, I'm assuming, some kind of mental work or processing a previous trauma. Yeah. What is it that the eye movement or that kind of bilaterality is adding that makes it more effective?
So there's a protocol that we work with in terms of how EMDR is set up for a clinical situation. So the protocol is making an assessment of the clients at the very beginning. That's the first stage, getting them into a comfortable place in terms of the relationship between client and therapist is really important. Client safety before anything begins. So this is the preliminary stage. Client safety is number one priority before we start anything. And partly to do with that is the relationship between therapist and client. If a client feels any tentative feelings before we start the process, I try and pick up on that, and we go back to just building up that trust again through different ways, but also through resources. So I use something called the safe, calm place or the peaceful place, which is like an imaginary resource and which helps the nervous system to settle. So after those things, and when the client is completely ready, we can start on a target. So the target is like a memory or an experience, and they call it something like the title of a book or a film. And then I ask a series of questions that opens up the memory network and activates the nervous system. So this is a really important part. When we're just thinking of a difficult thing and we do nothing about it, we go into maybe solutions or trying to fix it or distraction, that kind of thing. When you're focusing more on it with those kinds of questions that I'm asking, so I'm basically saying, and it sometimes can surprise people, so this is why the client safety bit is really important. The first question is, what's the worst image that you see from this thing that you have experienced? That immediately activates the system. Then I ask, what emotions are you feeling right this minute? And they might say fear, distress, disturbance. And then I ask, where do you feel that in your body? And that's a really important question because it's basically locating where that emotion and the distress is. And it can be anywhere. It could be the stomach, could be the legs, could be the shoulders or the chest. And if the client is still engaging in terms of being able to talk without getting emotional, then I might ask them, what do you notice that you're telling yourself? What's a negative cognition you're telling yourself? And it might be something like, there's something wrong with me, or I'm not safe. If they're getting emotional before that, I don't ask that question because it brings them straight back into their cortex, and I want them to stay in that activated place, because when we start the bilateral movement, when they're in that place, the brain starts communicating with the body, and basically the amygdala is online, so that's the activation, with the limbic system and the hippocampus. So the hippocampus is the memory network storage place. We are sometimes reminded of things. The hippocampus reminds us of things, sometimes on a daily basis, sometimes sporadically. But once we activate the specific memory from that place of the brain, coupled with the breath work, noticing what's happening right this minute, something happens where the worst bit is already over because we've focused on it. And once we start with tapping, so the tapping, you can do tones, so one tone to the ear and then the other with headphones. I have buzzers that people can hold and close their eyes and just get into it, or I have a light bar which they can move their eyes to. Once we start that bilateral movement, then it moves the activation on to the next bit. So what I'm trying to teach that person is, all you need to do is just notice what's happening next. What's the new information? What's the new information coming in? So if someone comes in saying, I need to get over this car crash I experienced 10 years ago, because whenever I get into a car, I feel panicky. I feel it in my chest. We'll start that protocol with, what's the worst image that you see when you step into a car? Not from the trauma that happened, but actually when they're getting into the car now. The physical sensations that they feel in that moment are related usually to something that's happened already. So we're letting the body move that physical sensation on. So when you asked about what happens when people come in with physical pain or physical symptoms, usually it's all connected with an experience, how the nervous system has responded, how the brain has responded, how the amygdala is still in threat mode, fight, flight, freeze kind of thing. And when we are starting a target like that, we're inviting the system to recover from whatever's happened. So when we go with the symptom of the body symptom, say there's chest pain or something like that, or a feeling of a panic attack coming on, I ask them to breathe right through it, because sometimes it can feel like it's happening now, but it's a reduced symptom of it. So it's like a revisiting, and I have to remind people of that it's not happening now. You're in therapy with me. The car crash happened 10 years ago, and when you stepped into your car last, it was maybe last week. So you're not there right now. You're in my therapy room. So that is quite a relieving thought that, okay, I can look at this from a little bit of a distance now. So when we get going with the bilateral movement, the body tends to, especially with deep breath work, so I tend to ask people to breathe in through the nose and out through the mouth. When that happens repeatedly, long, drawn-out breaths in through the nose, out through the mouth, the body tends to then shift from sensation, different parts of the chest. It might move to the stomach, it might move to the neck, it might go behind the eyes. People report that it's the sensation of distress has moved around their body. And the way I'm tracking it is how much do you feel distress when you think of that title that we made up of the film or the book? When you think of that now, what's the first thing that comes into your head? You might say, well, the image has changed. I don't, I'm just actually looking at the car now. I'm not in it. And I'm not feeling as much fear as I did before. And then I might say, well, where do you feel that thought in your body? And then I say, okay, well, I feel it in my shoulders. As long as they're still reporting body sensations and symptoms, we still go, we're still going, we still carry on. Because the body is the true responder to any psychological distress or issue that we're working on. Even if the thoughts are clear, the image is fine, if the body is still going, I'm sorry, but I can still feel a niggle in my stomach, or I feel a bit breathless, then I still know there's something left over. There's a residual feeling left, which is probably unconscious, probably not noticed in daily life, apart from these symptoms that are coming up. But what's important is that we can still work, and we work and we work and we work until the body feels completely clear. And I ask people on a scale from 0 to 10, usually at the end when I know I can see a person has come right round and they're talking much more kindly about themselves, or they are able to sort of go, wow, I've just seen this and it's just really changed my view on it now. I then ask them, where on a scale from 0 to 10, where 0 is no disturbance and 10 is the worst, where do you place yourself in terms of distress or disturbance? And they probably will say maybe a 1. I never ask before that point, because it's you usually know it's going to be a 9 or a 10 or an 8. There's no point asking, because you're just sending them straight back into the cortex again, and it's not helpful for the processing.
It sounds like quite a delicate process of bringing them back to that trauma, but doing it in a way that is lessened. So you just you're almost just trying to tell the brain that it's safe, that actually you don't, it's okay. Whereas before, the brain has just been panicking about something that perhaps it shouldn't be, and it's overreacting to something, isn't it?
Yeah.
Does that sound about accurate?
Absolutely.
Yeah.
Absolutely right.
Yeah.
I think the thing for me as a clinician to keep reminding people is that you're not in that position now. We're not in that same car. We're not in that same house. You're not 7. You are a grown up. You're in my room. We're thinking about this in 2024, and that very sort of thought process is so helpful, because sometimes the body and brain are stuck in a place, stuck and blocked from realizing that actually I'm free of that. I'm not going through that right now. And it's a strange one. Us humans do get these hang-ups of worry and anxiety. Creatures don't tend to sort of have that same pattern. I've just noticing how dogs, I've got 2 dogs, Cocker Spaniels, as you know, when they have a difficult experience, they tend to sort of, they shake it out. They're very body-based, shake it out, or they bark. They're really sort of like very vocal bodily sort of things going on. We tend to intellectualize or distract ourselves or just get on with life, as sometimes we have to. And the brain just continues to try and sort of keep going with that worry process sometimes. And it can be very destabilizing in terms of, just sleeping and body functions and all kinds of things. If anxiety can go unchecked,
do you think anxiety? Do you think I appreciate this might be a bit speculative, but do you think anxiety? Well, let me ask it this way, actually. How do you think this process, so the process of the brain overreacting to trauma and holding on to trauma, how do you think people have or how do you think that's changed over the past decade or even centuries? I mean, if we compare ourselves I suppose what I'm asking is what role does the way that our society is set up, what role does that have in making these better or making these worse? Do you think we would have had these in the same way if we go back a few centuries, particularly in the last couple of centuries? Because currently we live in a very, very, very different world than it would have been in the 1800s.
Yes.
Instant gratification, etc. What do you think about that?
My first thought is about how it depends on where you live and where you're from and what's going on, but we generally don't live with too many sort of real-time threats. So I think maybe like 200, 300, 400 years ago, death was around the corner all the time. Babies died a lot in childbirth, so did mums. Disease was widespread. Barbaric behaviour. I mean, we get that now too, but I suppose maybe modern society, there's less of that going on. So perhaps, I don't know, there's more space, there's more... I think we also may be working less with our hands in terms of we're not labouring as much as we had to when we, just sort of in terms of industrialisation, technology, how that's changed. We are much more sitting down rather than walking about or moving about. There is also much more awareness now around mental health, as I said, and talking about feelings. I think that's come up much more now in terms of modern discussions. It's okay not to be okay, and all that stuff is absolutely rightly so in the arena of society. I think sometimes in the past people had to hide things depending on their status. I think that can happen now as well, but perhaps less so. So then if people don't have to hide things anymore, then perhaps they're noticing more what's going on in their body. With all those factors sort of at play, we're not doing as much manual labour, we're sitting down more, we've got more free time, we're not thinking about death all the time, or survival. Perhaps anxiety is, I don't know, worries have always been around, but perhaps it's more intense now because there's more space to think about it. I don't know. I mean, I'm sort of trying to explore, I suppose, a few factors there.
And we can see why we as humans experience anxiety. It's obviously a very important thing to experience.
Yeah.
And as you were saying, particularly go back far enough, there were continuous threats to our health that could cause death. So you needed to have a level of motivation to keep you out of that. And I suppose now that we're in a society where that's not so much the case, we can now use that mechanism. It's almost like the brain just wants to use it. Like it's used to using it, and it thinks, well, hold on, there's no threats. This doesn't make sense. So what can we do as parents to reduce trauma in children, or to give them the best possible start?
I think the first thing to realise is there can be no perfect parents. I think when you think like that, there's a bit less pressure to try and work so hard to make everything perfect. It's okay to have a mess or a rupture. It's okay. I think parents that look after themselves, that look after their mental well-being, and that can sort of find space for themselves, can also then have space for their children, and thinking about and just giving them space to have their emotions or express themselves. I think boundaries are quite important sometimes as well. At the right time, the right stage, appropriate boundaries. It's hard, I think. Sometimes children do get into this place of protesting and, that's mine, and, all the sort of little Nero tantrums. And that's hard to deal with. It's very hard to deal with as parents, I think. Sometimes you want to, okay, for a quiet life, I'll just let you have what you want. And it depends on the circumstance. But I think sometimes when parents hold their ground and be consistent, that can help get that security of the boundaries and containment for the child. The child can feel a bit safer and that the parents are in charge. I think also just having an environment outside of the family home, supportive environment, community, if possible, that can help. Like knowing that you're not alone is very important.
Interestingly, some of the longest living, the blue zone, which is five areas of the world where you've got some of the longest living people, or at least the most amount of centurions. One of the biggest commonalities they saw there was their strong community.
Yeah.
And they had a community, not just we've got friends across the road, but they got people they need, that they rely on, and they're people that rely on them because they've got a community. I suppose in our society, our community in that sense is our entire country, or maybe even the world, because we get we get our food from the supermarket, we get our water from the water company, and everything's kind of, nothing is local anymore, is it?
Yeah.
And interestingly, some of these longest living people and healthiest people, according to the study at least, they have small communities, which is how it would have used to been. There's obviously big advantages to the way that we have things, but I think that's maybe one of them, is strong sense of community.
Yeah, because what you get then is a sense of cohesive living together. So we are, I think in the Western society, definitely more individualistic. I think there's benefits to that, absolutely. We can choose what we want to do and things like that. But there are also benefits to having that group circular living, and knowing that you can belong, knowing that you're part of something, that you can contribute to something yourself. I think that's really important, be able to take responsibility and take part in things. And then, there's a sense of a bit of empowerment there as well, just like in terms of positive empowerment.
You mentioned how, as parents, you need to look after yourself first, and there's a parallel there with when you're in an aeroplane, you put your own mask before your kids, which makes sense, because if you're dead, you can't help your kid. Do you think people that don't have mental health symptoms should see a therapist?
There is a benefit, absolutely, to understand oneself more, to explore in the safety of a contained space. And that's the other thing, like confidential space, just bearing all to somebody who can keep that confidential and sit with you to work it out, or sit and listen to a story or a song or something that you want to create in the sand tray or paint. My type of psychotherapy was with an analyst, a Jungian analyst, specialising in dreams. And it's so funny because I was trying to every week remember my dreams, and I can't. I find it really hard to remember my dreams, and I sometimes apologise. I'm really sorry. I just haven't got a dream this week. Of course, we dream every night usually, but whether we remember them or not is another matter. But that for me was, yeah, very interesting experience. And sometimes I just would walk in because we had to go. It was a choice, but to qualify with the profession I'm in. But I remember feeling quite sort of like, oh, do I really have to go again? And some weeks I'd have nothing to say, nothing at all. And other weeks I'd be, really grateful for that space to share something that happened or something I was feeling, or so yes, I mean, absolutely, I think it can be benefit to anybody. EMDR as well. I mean, it can be used for all kinds of sort of not deep complex trauma or PTSD, but also things like sugar addiction and sort of performance issues, or if someone's feeling anxious about doing a conference presentation or a performance in the arts or something, you can use EMDR to enhance that and get rid of any blocks and things like that. So it doesn't necessarily have to be someone with sort of diagnosable symptoms or conditions or things that they're absolutely wrapped up with and desperate for help with. It can be for things like that too.
Yeah, I mean, within chiropractic, we not for everyone, but for a lot of people, we recommend maintenance, and those that take up maintenance tend to, which is basically where we see people periodically throughout the year, in the same way we get checkups in the dentist. And we tend to find that those that do that, which enables us to be able to check them, doesn't necessarily mean, which is interesting, it doesn't necessarily mean we always find something to treat. So it might be that we just, the same way if you go to a dentist and they check you, they don't find any fillings, you run out celebrating because you don't want any fillings, do you? It's a similar thing with us. And but we find that if we find an issue, we can find issues before the symptoms come, so we can nip that in the bud.
Yeah.
And they're less likely to get issues kind of down the line, which makes sense. And so I would theorize that could be also a helpful thing then mentally as well. Do you think that if someone did that, they would be less likely to suffer with mental issues such as anxiety or depression?
I think if there's an ability to be able to talk through or work through or process through any current distress or disturbance or stuff that has happened, and be able to find that safe place to go to. Sometimes it can be meditation. Sometimes it can be, if a person is spiritual, it can be prayer or worship or sport, or, that sense of flow that you get with some, playing music or dance or things like that. I think if there's things like that in a person's life, there's definitely you're aiding your nervous system, you're aiding your mind, you're aiding your soul. So there's, topping up in terms of keeping the system running, keeping the system enhanced, enjoying life as much as possible. Sometimes that's not possible though, obviously for everybody, but as much as one can, sometimes it can be a friend down the pub, or friends, a group of friends, or a mentor. Doesn't have to be a therapist, or coach, life coach. But yeah, it's just outlets, isn't it? Just finding things to outlet things that happen, because things always happen. Life happens. Doesn't discriminate in that way.
Yeah, I think it's just the fact that you are talking about it is the first step, isn't it?
Yeah.
And you were mentioning a safe space. The fact that they know that you won't tell anyone would enable them to be more honest and more open, which therefore then they're going to get more out of it.
Yeah, sometimes if a person utters something for the very first time ever, like some kind of thing that they've kept hidden away, locked away, because either they feel so ashamed or so guilty, or that it's meant that there's been a ricochet of circumstances happen because of it. Uttering it in a safe place can be the most healing thing ever. Knowing that it's held and the therapist isn't obviously going to take that anywhere else, and will encourage, if someone is in therapy and does have that sense of being able to share something for the very first time, I try and treat that like a precious gift, because it's so important, that sometimes the most healing thing is to be able to put it into words. And I think with EMDR, like, it's a very direct form of therapy. There's a protocol. People ask for it. People ask for EMDR because they know, they've heard how effective it is and how quick it is. With that, you tend to get more of that. I'm coming to therapy because of this happened to me, or I said that and it's made me feel very guilty and ashamed. And so I think with that, there's sort of like an invitation to be really truthful and open. And I say to them, EMDR takes courage. It takes courage to be direct with the thing that you're struggling with, because we are looking at it in stark, bright light, in a sense. We're going to the worst bit of it straight away. And it's after the settling sessions in the beginning, we're looking at the worst bit of it, and that takes a lot of courage. Say to people, it's going to be intense. Some people don't show any emotion at all. Some people flood with tears. I have a tissue box in my room. If it's as a Zoom or a Teams call, I encourage the person to have tissues next to them, because it can get really, it can. And this is the other thing, like, when the system is flooded with emotion and we're using EMDR, more often than not, it's never going to get that bad again with that particular thing. You've been through the worst bit already. So, I mean, when we're processing an issue, sometimes, especially if a person has meditated a lot before, or has a spiritual life they're engaged with, or in a sense is open to what the imagination can do, sometimes they can have the most amazing images come into the memory or the thing that we're working with. I mean, I've had people sort of see angels fly in, just completely spontaneously, angels flying in to rescue them and carry them away from whatever situation they were in as a child. I've had people imagining there's a dog there to ward off a perpetrator or a threat. Just complete, not suggested by me or anyone. They have spontaneously brought up this information. And there's this consolidation process that goes on with that. So when we're looking at memories, we're asking the brain to consolidate that memory that's blocked, to assimilate it, to link the body and parts of the brain together. When that person has something of that nature come in, it instantly consolidates the thing we're working on. We're at a zero then, immediately, because there's no danger. They're rescued. There's something happened that's completely changed the perspective on, the terrible thing.
I imagine there's a lot of people that will know that they need help but are struggling to get over that barrier to make that decision to come and see someone like you. What would you say to someone like that?
It's an interesting one. It depends on the person. I think checking out with someone else, what do you think of this person? What do you think of EMDR? Or, you know me the best. Can you support me in this process? If that's in place, then there's some support there, and it can be helpful to have that and to boost confidence a bit. Having a consultation sometimes can help. I do that quite a bit. Most therapists will have a consultation before they start working with someone. that's from both sides. So we're, checking that they're able to, hold a conversation at least, that there's certain things in place. But also for them to hear the therapist's voice, to see their face, to know that they're meeting them, perhaps eye contact wise, and to hear a little bit about the modality or the type of therapy. That can be very helpful just to familiarize sense of what might happen. So just getting that sense of, who are you? What do you do? Can I trust you? And maybe for some people that will be asked several times, can I trust you? They might not say that to me, but they will feel it. Can I trust you? And you might know this, but the muscle of the body doesn't let go until it feels completely safe to do so. And so does the mind. I think that's can be said for the same for the mind as well as the body. And so that, for me, that's number one priority, just helping people come to that place of, okay, I can breathe, I can feel met. This person is hearing me, validates me.
Well, thank you. I think that's given a nice eye opener to what mental health, what getting help for mental health looks like, and for what the types of things that you're doing. And I think the type of work you're doing is super, super important, because without our mind working well, really nothing else works very well. Certainly our bodies won't work well if our minds don't work well. So staying healthy in that area, optimizing that, and ensuring that we're not letting these things. I get a lot of people in my practice, after we got so far down the road and we've got rid of their pain, or they're back to doing something they love doing, and they've had this thing for years, commonly they say, I wish I did this earlier. And I think that's a bit frustrating as a practitioner.
Yes.
Is that we know people are suffering, we know we can help them, but to be fair, people don't always know. They don't know whether you can help often. They don't know who can help. They don't know where to go to. And there may be things that may be stopping them from doing that as well. So no, I think you're doing your patients, doing the people around you a fantastic service. And thank you for giving us some insights onto that.
You're welcome.
If someone wants to be able to find an EMDR therapist, how can they do that? And also, how can they find you?
So with EMDR, there are several registering bodies. So there's one in America, or the foundation in America, called EMDR International Association. That's where it all started in America. I'm a member of that body. And there's EMDR UK as well, EMDR Europe. I think there's EMDR Ireland. So Googling EMDR UK or EMDR International Association, there's a directory on them, counselling directory as well. I have a profile on there. But yeah, Google is a good place to go to find a qualified person.
Fantastic. Thank you very much.
Yeah, welcome.